morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will be on your health. We'll discuss a number of things from campaigns to stop smoking to ending substance abuse. We'll also talk to a representative from Milwaukee Health Services, Inc. about their upcoming Laughter for the Soul event featuring Cedric the Entertainer. But my first guest, they represent an organization that works to save lives by improving lung health and preventing lung disease through research, education, and advocacy. Kimberly Bestul is the FACT coordinator for the American Lung Association in Wisconsin, and Lizzie Covington serves as the director of development for ALA. How are you, ladies?
Hi.
I appreciate you both being here.
Thank
and
you.
It's amazing. When you think about the American Lung Association, it's been around since 1904. So if you would, tell us more about the mission and what it is you do.
Yeah, well, absolutely. So the mission, as you said, is to save lives by improving lung health and preventing lung disease. So we accomplish that through several ways. We do research. We have education services and advocacy efforts, both nationally and locally. Right now, more than 35 million Americans are suffering from lung disease.
Wow.
And that's a statistic that we want to change. They're suffering from COPD, asthma, lung cancer, IPF. One of the ways that we help to combat those issues is through things locally like our Better Breathers Clubs. Our Better Breathers Clubs is local organizations where we can have both patients and their caregivers get together locally and talk about their diseases, their triggers, what it's like to live with COPD, which is chronic obstructive pulmonary disease. And then we try and facilitate those meetings with giving them different ideas on ways to cope and making sure that they don't feel alone. So that's one of the things that we do locally.
Yeah. And you guys have really a lot of free tools and resources to help individuals because, like you said, there's this long list of lung diseases that people deal with, everything from asthma to, like you said, COPD. And so when you talk about resources that are available, people don't always know where to turn. So they can easily call you guys and say, this is what I'm dealing with, and you have a list or a plethora of organizations that you work with that can help them out in many different ways.
Absolutely, yes. So going to simplelung.org takes you to, just like you said, a plethora of information, different research efforts that we're working on right now, as well as those programs locally. You can call our 1-800-LUNG helpline, which is actually staffed with nurses and respiratory therapists, where they can answer questions that you have as a patient or a caregiver to just help you cope with the struggles that you're having if you're new with lung disease or if you've had it for several years. Ways to talk about asthma with your child and how to prepare them in schools when you're getting ready to go back to school.
Yeah, and speaking of children and youth, Kim, the ALA has what's called the FACT program, and so if you would tell us more about that.
Right. So the FACT program, or the FACT movement, is Wisconsin's Youth Tobacco Prevention Program, and it targets youth from 7th grade to 12th grade, and it empowers them to spread the truth about tobacco. This is done through various advocacy initiatives like peer-to-peer education, community outreach through the media, and meeting with their state and local leaders.
Yeah, makes a lot of sense.
Right.
And so when we talk about the truth about tobacco, because we hear that a lot, I think it's no secret to everyone that smoking can cause cancer, and cancer kills. But really, in this day and age, tobacco's not what it has always been. It's changed, especially for young people. So what would you say is the truth about tobacco in this day and age?
Well, right, tobacco is changing, and the most common found tobacco product is e-cigarettes now with the youth, and or commonly known as vaping products.
Yeah. And it's scary when you say vaping. You had the Milwaukee Health Department recently issue a stern warning against vaping. So working in your position, hearing something like that, what steps do you take next in order to help young people better understand the dangers of this epidemic that really still has a verdict out? We don't really know the effects, the long-term effects of vaping. We're starting to see some evidence that there are clearly some dangerous scenarios people find themselves in.
You're right, and we're empowering youth to spread the truth about tobacco with their peers at school or community centers. We have various groups throughout the state, even a few here in Milwaukee.
Yeah.
So we're telling them to tell their peers that vaping is a problem, and there's so many chemicals that harm their lungs, causing irreversible lung damage.
Yeah.
These vaping products contain nicotine. Many of these products do.
And kids think that it has nothing to do with tobacco at all.
Right.
Right.
Yeah.
Right.
Or nicotine that's in tobacco products. So how do we break that? Because I remember growing up, you know, and even most recently, they showed us pictures of people who had to have, who had throat cancer, and you saw all those different commercials that really made you stop and think like, oh, I don't want to go through that. But you've got vaping where there's at least an estimated 400 e-cigarette brands and an estimated 7,700 flavors available for them to vape on a daily basis.
Right.
Scary.
It's terrifying.
How do you break this new thought about vaping, that it's okay?
Well, the fact is youth driven. So the youth empower them, their peers, so their friends. They tell their friends what's going on. And one way that we can share the information is with parents.
Yeah.
So we tell the parents, like, hey, these vaping products or e-cigarettes, like Juul, they contain nicotine and other chemicals that cause irreversible lung damage and contain nicotine, like I said before, that hook teens and harm the developing brain.
Yeah, and to not know the long-term effects is even scarier, I think. It's, you know,
Right.
I don't know what to say, and I'm thinking it's very scary for a lot of parents out there. Before we run out of time, the American Lung Association in Wisconsin, you have your Lung Force Walk coming
Yes.
up, and that's a pretty big deal.
Yes.
It's a major fundraiser. If you would, tell us all the
Yeah.
details we need to know.
Yeah, so the Lung Force Walk is a really great way for you to get involved locally, you know, to help combat these issues like vaping and tobacco. So the Lung Force Walk is on September 29th. That's a Sunday, and it starts at 8 a.m. So we are hoping to get around 1,500 folks at the Milwaukee County Zoo.
Wow.
And we're hoping to raise $100,000. So the event is actually free to register. So folks that register ahead of time, they enjoy a free access to the zoo and free parking. And then they enjoy coming together with their family, friends, and their coworkers as a team or individually. They join together, they do a 1.5-mile walk throughout the zoo. They get to enjoy seeing the animals, spending time with their loved ones, and then also celebrating those folks that have survived lung disease and those folks that they have lost.
Yes, remembering those that they've lost to this terrible epidemic. So
Right.
here's the thing, if someone wants more information on how to get registered, find out everything that's going to happen that day, where do they go for more information?
Yes, so they can go to lungforce.org/Milwaukee, and they can register there on the website. It takes about 2 minutes to register, and like I said, it is free to register, although we encourage fundraising. Obviously, we are hoping to raise funds and awareness for lung disease. But they can also call our offices. You know, we have several folks that are just not as comfortable on the computer. We love to be able to help them, register them over the phone, so they can reach out to us at 262-703-4200, and we can get them registered.
Thank you. Ladies, great information you've shared with us today. Hoping for that goal to be reached and
Absolutely.
continued success with you both.
Absolutely.
Appreciate your
Thank
time.
you.
Thank you.
Kimberly Bestul. She is the FACT coordinator for the American Lung Association in Wisconsin, and Lizzie Covington, she serves as the Director of Development for ALA. Keep in mind their Lung Force Walk again is happening on Sunday, September 29th at the Milwaukee County Zoo. For more information, visit lungforce.org/Milwaukee, or you can give them a call at 262-703-4200. When we return to Our Issues Milwaukee, we'll find out more about an organization that's dedicated to promoting health equity and reducing the death and disease caused by tobacco use and exposure in the city of Milwaukee. We'll talk about that and more with Community Advocates Public Policy Institute right after this.